Welcome to Physicians Keepers. Each episode features honest conversations with physicians, sharing moments that shaped them, challenged them, or taught them something worth passing on. These stories come from every corner of a physician's life: the clinic, OR, family, finances, mental health, leadership, and personal growth. If a story can help another doctor feel seen or strengthened, it belongs here. It's about honesty, courage, and community true storytelling. If you are looking for connection or a reminder that you are not alone in navigating this profession, you are in the right place. Hello, and welcome to another episode of Physicians Keepers. I am so excited to have you here today. If you are watching on YouTube or you're listening on Spotify, thank you once again for joining us as we are going to have another interesting conversation with my amazing guest, Dr. Nanette Nuessle. I'm excited to hear her story, her journey, her resilience, and her journey. And as I'm sure you will also be. So I'm just going to give a brief bio for Dr. Nanette. She is a physician. She's actually a pediatric hospitalist. She's a TEDx speaker and she's a transformational coach who helps healthcare professionals rise above burnout and reclaim their confidence, calm, and purpose. With nearly 4 decades in medicine, her career spans magna cum laude honors in chemistry, 2 terms at Oxford, chief resident in pediatrics, chair of pediatrics, and recognition as the first graduate of a pioneering medical genetics fellowship. She has delivered national presentations, author research, and led department-wide improvements in staff retention and patient care. Today, she is the founder of Beat Down Burnout, where she delivers keynotes, on-site trainings, and group coaching programs that integrate science with transformational practices. Dr. Nanette, you are amazing. I mean, you've been in medicine for years, and we're so excited to have your wisdom and your knowledge today.
Well, thank you, Ellie. I am honored to be here.
Well, so you've spent 38 years in the front line as a pediatric hospitalist.
39 now, yes.
39 years,
Yes.
oh wow. When you look back at your career, what stands out to you? Not just professionally, but what stands out to you emotionally over the course of these years?
Emotionally, there are two things. And I'll mention the first one. I'll mention this one first because it's actually a consequence of the second. And that is, I did not feel comfortable in my skin as a physician or as a pediatrician until probably about 5 years ago. So it was
Oh,
after 25 years of helping teens make lifestyle choices, of doing all the things we do in the well child care, of taking care of some kids in the hospital who had really unusual stuff. And if I hadn't done a background fellowship in medical genetics, I never would have been able to manage those kids, as well as taking care of the babies in the nursery. Everybody thinks taking care of the babies in the nursery is a piece of cake, and it is until it isn't.
yeah.
And um, we have about 1 to 2 babies a week crash and need immediate intervention.
Yeah.
And most of the hospitals I work in now are both have level 1 nurseries. So it's a matter of managing these children and stabilizing them until a transport team can get there.
Yeah.
So I was really, really not comfortable with that until about 5 years ago, and not comfortable with the idea that every day I go to work, I might see something I've never seen before and have only read about until
Yeah.
about 10 years ago. And
Oh,
that's what it means to be in medicine.
yeah. Yeah.
But why was I so unsure of myself? Why did I feel that I didn't have the tools I needed to have when I graduated medical school, got right into a fellowship or a residency and then a fellowship? I'm board certified. Why did I have these feelings that I wasn't enough?
Yeah.
And the answer to that is the second emotional problem that I've seen all along. We are taught in medical school that we are unworthy.
Yeah.
We are systematically driven to believe we're not good enough
Yeah.
through the pimping that is done on rounds. And I don't know if that is still a thing. It was a
Yeah.
thing throughout med school for me.
Yeah.
We only had a few attendings that did it in fellowship,
Yeah.
and we did, or I'm sorry, in residency, and we didn't have it in fellowship. So I don't think that's a productive part of our learning process because it trains us to become victims of bullying.
Yeah.
And I
Yeah.
saw bullying all the way throughout my career. I saw classmates who were bullied in medical school. I saw that in a in residency, we had 5 or 6 residents in each class, and there was always one person in each class who was picked on,
Yeah.
given a worse call schedule, expected to cover more holidays, all of those things. And it often wasn't because of their ability as a physician, it's because they didn't look the same.
Yeah.
They had an accent.
Yeah.
They couldn't afford to dress the same as some of the other physicians,
Yeah.
things like that. And I think it became something that started guiding my career choices when I was working. I got my first real job and I was doing both pediatrics and medical genetics. Worked my way all the way up to chairman of the department, was there nearly 20 years. And it was a huge multidisciplinary clinic. But when I repeatedly saw primary care, particularly family practice and pediatrics,
Yeah.
um, getting the short stick financially year after year after year,
Yeah.
some of our orthopedic surgeons were bringing in over 6 million a year,
Yeah.
and some of our primary care physicians were. Most of our primary care physicians never crossed 150,000.
Oh, wow.
And when we tried to change that,
Yeah.
we were told that we weren't worth it. We were literally told that by the surgical specialists.
Oh, wow.
And I'm like, this is not the environment I want to work in. This is not good for me.
Absolutely.
So I moved on and started doing locums. And one of the places I did locums, it was fantastic. They hired, this was after I started doing just inpatient, and they recruited me because they were reopening their labor and delivery, their their maternal, what do they call it? A mother baby unit. They
Yeah.
were
Yeah.
reopening all of that, and they needed pediatricians who were comfortable resuscitating and stabilizing babies.
Yeah.
They recruited me so hard that they bought me out of my other job.
Yeah.
And when I got there, it was fantastic. It was really the best job I had had in over a decade. We had nurses who communicated well.
Yeah.
Everyone had each other's backs, everyone putting the patients first. If we had a kid who was crashing, people were comfortable suggesting things that we hadn't tried yet without
Yeah.
without you having to pull it out of them. So it was really great. And I had gone there as a locum, and they encouraged me to become a full permanent physician, which I did. But somewhere while I was making that decision and signing those papers, all the people that I'd worked with when I first started there, one by one disappeared. They
Mm.
were all travelers, and they were replaced by permanent people who
Yeah.
didn't have the same skills, particularly the communication skills.
Yeah.
And we ended up with a charge nurse who bullied me. She argued every bit of education I did with parents. She called me a liar
Mm.
in front of parents. She
Oh,
withheld
wow.
critical information from me on moms that would affect the babies. She wasn't just bullying me, she was bullying a lot of
Yeah.
other people in the unit. That was just her modus operandi.
Yeah.
She literally told me one day, I have to push everyone to their breaking point so I know where their breaking point is.
Really.
Really, this literally is what she said. And I began asking around about how the other staff were doing. We had seasoned nursing staff, women with 20, 25 years experience on both the labor side and the baby side, who were
Yeah.
fine until they started working there. And every one of them was now on either antidepressants or anti-anxiety meds or antihypertensives, or had been diagnosed with type 2 diabetes and was being treated for that. They'd never had that kind of stress prior to working with this
Prior to
charge.
working there. Yeah.
Yeah. And so for that many people to suddenly be sick enough to be medicated was really, really concerning to me.
Oh, wow.
And that's that was my impetus, my motivation for exploring coaching. And
Mm.
I'll be honest, I had my doubts at first. And I went through my first coaching program, which was on communication.
Yeah.
It wasn't on reducing anxiety. It wasn't on managing stress. It wasn't on
Dealing with bullying or anything like that.
no, nothing like that. And
Yeah.
halfway through the course, I started using the tools that I learned specifically with this one nurse, the charge nurse. And in 3 days, I shut down the bullying.
Really?
In 3 weeks, the nurse managers came to me and asked me to do conflict negotiation in other departments. And this was in 2020, in the middle of the pandemic. In three
Yeah.
months, we de-siloed the hospital. You know, we were short-staffed. We had a bunch
Yeah.
of people who just left because of the pandemic and weren't planning to come back.
Yeah.
And so nurses were being told to go to whatever department needed help on any given day. And I was hearing things like, I don't want to go there. They never even speak to us. I don't
Yeah.
know anybody there. They won't like me if I go there. Did a few lunch and learns, and within a month it was, oh, I get to go somewhere new and learn new skills.
Yeah. Oh, wow.
So yeah, that was proof to me. Those two things were proof to me that coaching works.
I
And
mean,
it can help, it can save healthcare.
it can. I mean, something you mentioned, like it's so impactful how people don't realize, the not just the emotional aspect of bullying, but also
Mhm.
the physical, right? Because you
Oh yeah.
mentioned people who, because of the high stress levels, then now they're dealing with high blood pressure, never been
Hmm.
diagnosed with diabetes. I mean, the emotional aspect is there, but it can also have a physical toll on
Oh
the
yeah,
body.
absolutely.
And
Absolutely.
people don't get to realize, people just think about, the stress, the anxiety, the depression, and all that, but they can show up as physical symptoms. Now, for you, I mean, you mentioned that you've been bullied pretty much, you've had bullying experiences throughout your career.
Hmm. Hmm.
What did those do for you internally? How did that change things for you?
You mean
Oh,
emotionally or physically? Because I had a
it,
lot of physical manifestations of stress myself.
yeah, so I mean both. So like internally,
Okay.
so physically,
So
emotionally, how did that turn out for you?
when that bullying, when that with that charge nurse was at its worst, I was not sleeping well at night. The sleep deprivation drove me to have migraines, which could not be controlled by medication.
Yeah,
Um, my blood pressure was 140 over 90,
yeah.
which previously it had been 90 over 60. So that to me is a
Oh wow.
significant change.
Yeah,
Um, I started having irritable bowel syndrome, which has since been diagnosed as ulcerative colitis, but I wasn't having symptoms of it until all that started.
yeah,
And um, I was gaining weight, could not, dieting and couldn't lose the weight. That's still an issue for me, but that's probably partly due to my joint injuries. I was getting up every morning, meditating for 30 minutes, doing yoga for 30 minutes in the hopes of controlling myself
yeah,
and my responses before I went in there. And it wasn't enough.
yeah.
Yeah. So
Oh wow.
what helped me was getting coached myself.
So after the coaching, you said it was this was more of a communication
Right.
um skills that you learned. So
Mhm.
like give me an instance, how did that play out with your interactions with her?
Okay, so I was using the Codebreaker Technologies method of communication, which they call BANK. And BANK is what they call the four personalities: blueprint, action, nurturing, and knowledge. And my primary code is action. I'm somebody who likes to jump in and do things right away.
Yeah,
Um, this charge nurse, her primary code was what we call blueprint, which is somebody who's very interested in systems and structures and traditions and credentials. And there's certain language patterns that go with each one of these four types. I began
okay.
speaking to her in her language pattern, and something switched in her brain, which made it harder for her to find something to bully me about concerning what I just said to her,
Yeah,
because I was speaking to her in her language. And eventually it helped us to connect on some level. Well, we're not friends. We'll never be friends, but at least we got to where we could work together without damaging ourselves and everyone around us.
Yeah.
From there, my coaching grew. I did an organizational training
Yeah.
with a cancer center who was having a 95% staff turnover problem. And I brought in a team. We did a weekend retreat. And from that 2-day weekend retreat, their staff turnover went from being 95% in January to 5% for the remainder of that year, just from a 2-day retreat. But I found out something in that 2-day retreat, and that
Yeah.
is that the physicians who are primarily responsible for this high staff turnover were dealing with past trauma and
Oh, wow.
bringing all that past trauma with them
Yeah.
to work, which looked like poor communication skills, poor interpersonal skills, possibly bullying. And it made me realize that if I really want to address bullying and changing organizations, improving communication,
Yeah.
I needed to be trauma informed.
Oh, wow.
Yeah.
So just a series, I mean, like you said, it's just a series of experiences that kind of open your eyes to a different approach with bullying and how to navigate it in your
Mhm,
sphere.
mhm.
Um, why do you think that, especially in medicine, why do you think that such cultures are normalized?
Oh,
Why do you think it,
there's a history behind this as an
okay?
educational thing. So, like I said earlier, it starts in medical school. We are trained to believe that being pimped on rounds, which is a form of verbal abuse, is
Mm-hmm.
normal. We are
Yeah,
trained to believe that working 36 hours straight is normal. And this is all based on educational, I don't want to say norms. I'm not sure if systems is the right word, but an educational blueprint
yeah,
that the military followed for decades.
yeah.
The military has stopped doing that because they have done research that shows it does not improve learning. It does not improve your ability to handle an emergency situation or a life and
Yeah,
death situation. So they've stopped, and yet it persisted in medicine.
yeah,
And there is pushback right now.
yeah,
So when I was when I was in residency and fellowship, there was no limit on the number of hours we had to work.
yeah.
We were given 4 weeks of vacation a year, and we had to take it all at once. We couldn't spread it out to give
Oh, wow.
ourselves a bit of mental health. I know, right? And now my two nieces, who are one's in med school and one has just completed a fellowship, they never had those
Yeah,
expectations. I look back at my medical school and think about how they did it when was there, and now they're using what they call a docent programs, where all the students were put in teams, and
yeah,
you break up the material that you're studying, and each person has a certain part of it that they then teach back to the group, and they're led by either medical students who are higher up in training or by residents, and it is improving the board scores of
yeah.
those
I can
students,
imagine. Yeah,
which is why the schools keep doing it, but it's also improving the mental health of those students. It's improving knowledge base of the students who are the docents.
yeah.
So it's a win-win-win situation, but
Right.
that was not my experience.
Yeah. I mean,
Yeah.
there's a lot of focus now that has come into physicians and mental health, which wasn't there in the
Mhm.
past, right? Where we were just concerned with how much you could produce, right? How much you could show up and just do your work, right? Not caring so much about the mental aspect, the emotional, the psychological toll that, about a physician. It's like you were just there, do your job and deal with whatever is handed to you, but we're glad that we're stepping to an era where now, we're free to talk about such things and not get penalized or not look like you're weak because you want to have a
Mhm.
mental break,
Mhm.
right? Because our mental health, which had, like I said, has been downplayed for so long, it's so important for a physician to show up 100% physically at their job, they need to show up at 100% mentally, right? And that's why the rates of, physician suicide, physician burnout were at an all-time high.
Yeah.
Yeah. But like I said, I'm
The
glad.
World Health Organization states that the number one risk for burnout worldwide is being a woman in medicine, which directly correlates to your risk for committing suicide.
Oh, wow.
And the risk of suicide for a woman in medicine is 20 times that of the general population. The World Health Organization also says that the number two risk for being bullied in medicine is working in the US.
Oh,
I
wow.
see that as an opportunity for change.
Absolutely.
Yeah,
Absolutely. And like I said, I'm so glad that we have voices like you who have lived through the experience. Now you have the tools, right, through
right.
coaching, to help educate other physicians about the harm of it, right? And really glad about that. Now, through your experiences, right, and you were dealing with all these things, psychologically, physically, how are you still able to show up for your patients to and do what you're supposed to do? Because that's hard. Like when you're dealing with a lot of emotional struggles and also physical, how do you show up for patients and just and do what you need to do?
It wasn't easy, and I'm
Yeah.
honestly not quite sure how I did it. You always try to put your patients first
Yeah.
and your family second, and you become a distant third.
Yeah.
So I managed to, I don't know that I really took good care of anybody, but I managed to hold things together
Yeah.
until I could finally make some good choices about where I was going to work. For years, I would just take, as a locum, I would just take a job where I was needed.
Yeah.
And it took going through some really, really stressful situations before I realized, hey, I can choose to go work in places where I want to be. I can choose the
Yeah.
census. I
Yeah.
can choose the level of acuity. Now,
Yeah.
could I have done that straight out of med school or residency? Not, didn't have the experience to be able to do that, but I also did not have the self-confidence.
Yeah. Yeah.
Yeah.
Yeah. And what he said was so important because sometimes we get so stuck in a situation, I mean, early in your career, maybe like you said, you didn't have the skills, but at some point in time, when you're in a position where you can decide where you want to go, what you want to do, how you want to be treated, the type of environment you deserve to be in, it's important that physicians we know our worth. And you
Mhm.
question it boils down to knowing your worth, right? Because you probably didn't feel at the time where being bullied that you were worth having to go somewhere different where you appreciate it. And when after you had that mental reset, it's like, okay, I'm worth it. I bring a lot to the
Yes,
table,
yes.
you know?
I spent a lot of time in meditation asking myself,
Yeah.
why do I keep ending up in places where I'm not appreciated? And it's
Yeah.
because I wasn't appreciating myself. It was just a reflection of what I was
Yes.
putting out in the world.
Yes.
And it, I don't know exactly when that mindset changed. I really don't. But I do know it was the result of me getting coaching myself and finally beginning to understand who I am inside of myself
Yeah.
and how to stand in my own sovereignty and power,
Yeah.
not control, because that's
Yeah.
different, but my
That's
own
very different.
power and say, I will not do this. I will do this, but I will not do this. And be willing to walk away from a job if that's what it takes.
Yep.
Because you know what?
Absolutely.
There's a ton of other jobs out there right now. There's not exactly an excess of physicians.
Yeah.
And there's still life outside of medicine.
There
So,
is. There is. And it's something that a lot of physicians, I would say, struggle with, Rod, because when you've been in medicine for so long and you've
yeah,
done it, and that was pretty much, that one goal that you kept working towards, and you got so narrow focused, trying to see a life outside of it or you don't feel like you have any value outside of a doctor. But there
Or you feel,
is,
or you feel if you walk away from it, you've somehow failed.
yes,
How did you
yes,
fail? You're standing up for yourself. You didn't fail anyone. But there is so much else out there. There's research, there's insurance work, there's chart review, there's medical expertise. Or give it all up and start giving people tours in your town doing hiking or swimming or whatever.
yeah,
People have left medicine to start teaching surfing.
yeah,
There are other things out there that can bring you happiness and joy, and you only have this one life.
absolutely.
Don't spend it being miserable.
Absolutely. And it's something that I wish that, and I think some medical schools and some residency programs are, they're kind of bringing that in, right, into their training where they teach doctors that there's more to medicine than just the clinical part of it, right? Where, like you said, you can go into coaching, right? Now, if there are physician coaches, a whole
Oh yeah.
lot of them who
Yes.
pretty much retired from clinical medicine and started, coaching practices and thriving with that. There are leadership opportunities that you can take up, right? Administrative roles
Oh
that
yeah.
you can do as an MD. Like so many aspects of you that are not directly tied to medicine. And if this is, and like I said, some people love clinical work, and I mean, that's amazing. But then if your environment is robbing you of your joy, robbing you of your self-worth, robbing you of your mental health, then you do have the choice. You have the choice to take it back and say, I can do something different. And like you said, it
Absolutely.
boils down to self-worth, right?
Yeah.
Knowing your self-worth, knowing
Yes.
your values, knowing what you want, and knowing that, like I said, life is too short to be miserable. So yes, well, thank you so much for that. Now, what did this experience teach you about setting boundaries, though? Everything that you've had to experience, what did you learn about boundary setting?
When I was a child, anytime I tried to set or stand by a boundary, I would get beaten.
Mm. Oh, wow.
And when I tried to set boundaries as a medical student, I would get yelled at and pimped on rounds for days. They
Mm.
would make an example of me.
Yeah,
Um, didn't get that in residency, didn't get that in fellowship. But when I started my first real job, about 2 to 3 years into that, I started noticing that creeping back in, and it was part of the culture at that particular place. And once you're aware of it, you can't unsee it. So I made a decision in my life. What things are my real boundaries? My real boundaries are if you have a policy and you expect me to follow it,
yeah,
you need to follow it also.
yeah,
I'm not going to go against, I'm a pediatrician. I'm not going to go against the American Academy of Pediatrics guidelines
yeah,
for how I treat patients. And those are the two that I stand by no matter what.
yeah,
Does it sometimes mean I work a few extra hours? Yes. But it makes a huge difference for that patient. It can be a life and death thing for that patient. So to me, that's worth it. And as a pediatric hospitalist, I can work 1 week on, 1 week off
yeah,
and recuperate on that week off. So that's been a huge move in my favor that was actually suggested to me by um, several of the recruiters for the locum companies that I worked with. They're like, we think you should do this. And they could see that it fit my personality to be
yeah,
the one running into the emergency.
yeah,
So it was a really good change for me to do that. Um, each one of us has to look inside of ourselves and see what is it we like about our job, what is it we don't like about our job. And somebody recently suggested go make a list of the things you want to get away from
yeah.
in your job because it's easier to see what you want to get away from, but that will point you toward what you
What
really
you
want,
want.
which is so much harder for some people to verbalize. But then, so you got this list of, I don't want this, I do want this. So then you can, once
Yes.
you have that list of what you do want,
Then you can, yeah.
then you
Yeah.
can start making that shift in your life.
That's really amazing advice, and I hope someone listening here would just kind of take inventory, right? Because sometimes you can be so caught up in the weeds and work that you and
Mhm.
then it's the grind that you don't stop to actually ask yourself, what really don't I like? And what it is that would you just take whatever's handed to you until you realize
Yeah.
I don't have to. I can actually choose. Yeah. Now, tell me from a coaching standpoint, for people who are like curious as to what does she mean by coaching? Like, what is this about? Like, can
Well,
you
let
give
me
some
approach that from a
insight?
yeah, let me approach that from a trauma-informed coaching standpoint. We all have past trauma. It
Yeah.
may be big T trauma, it may be little t trauma, but we all have past trauma. And how we responded to that trauma when we were younger set neural pathways that kept us alive. Those were our survival mechanisms.
Yeah.
And now, when we go into emotional hijack or fight, flight, fawn response, those same pathways are triggered, even if it has nothing to do with what's actually going on right now. So you can go into this fight, flight, fawn response from having a patient code, and you can equally be sent into that by a poorly worded email.
Mm.
And when you think about it, we all know we've done that. We've felt that, oh my God, what? Yeah. So we've had that panic response to an email when in truth, it's just words on a paper and nobody's dying. Nobody's getting fired. Um, but it's hard to rewrite those neural pathways all by yourself,
Mm.
especially if you don't know they are there.
Yeah.
If you're finding yourself triggered by things at work all the time, that's your past trauma at work. And it's
Mm.
influencing you
Yeah.
to be short tempered, to have a tone of voice that you don't really mean, to perhaps say things you really don't mean. Um, and in a place of work or at home with your family and your spouse, that can have long lasting consequences.
Yeah. Yeah.
So, what I do as a coach is I help you to start to recognize those patterns,
Yeah.
what's triggering them. And then we go back in time. Is this something that happened in high school? Is this something that happened in grade school? Is this something that happened even before that? And there are different techniques we use to release those depending on when that root cause was.
Mm.
And once you, by release that, we release the emotions associated with it, most of which are
Yeah.
negative. We
Yeah.
release what we call limiting beliefs, what you believed about yourself because of that experience.
Yeah.
And I mean, if something happened when you were 3 or 4, you start believing that you're a bad person,
Yeah.
that you're not worthy of love, that
Yeah.
you don't deserve to live. And people can carry that with themselves throughout their entire lives.
Oh, wow.
And coaching is there to stop that cycle and to help you plug into your joy, your peace, your calm,
Yeah.
and completely rewrite how you interact with the world around you.
Oh, wow. That sounds amazing. I mean,
It
it
is.
sounds like, I mean, you've had so much success with it. And like I said,
Mm.
it's transformed your life. It's
Yes, it
transformed
is.
the way that you approach things. That's amazing. Now, what do you think that we need emotionally that we're not getting from your
Safety.
experience?
Safety.
Okay.
We need emotional safety.
So what has that looked like for you? I mean, just the physicians that you've coached, what did the outcomes look like for them after learning that they needed that?
Believe it or not, most people look at emotional safety not as, oh, I need more time off or I need to be able to say no to this situation. It's knowing that I'm not going to get triggered every time I go to work, knowing that if the person next to me blows up unreasonably about something, I'm going to remain calm because
Yeah,
I know what my triggers are. I've identified my triggers and I've taken the emotional weight out of that so that I can respond to the current situation and not all of the past situations that I'm carried along with me. And when you have safety, it's much easier to build trust. When you trust your team, everyone works better together and your patients have better outcomes.
Absolutely.
Yeah.
Absolutely. And like you said, people underestimate patient outcomes when it comes to these things,
Mhm.
right? Because they don't just affect the team, they don't just affect the physician. It can lead to disastrous patient outcomes.
Oh,
If,
absolutely.
yes, if there's team breakdown,
Mhm.
um, everyone's so emotionally labile, communication breakdown. Because I mean, with patients, right, a lot of it boils down to communication, right? And if that pathway is broken, then yes, it would definitely lead to disastrous outcomes. So I'm really glad, to hear what you're doing in the sphere of coaching and hoping that, physicians would definitely explore that, especially if you're dealing with, you know, baggage that sometimes you don't even know where it came from, but then you
Yeah.
see yourself acting out in certain ways and like, why? How did I end up? How did I end up like this?
I'm responding to this because that's the way my mother responded to it. That's the way her mother responded to it. That's the way her mother responded to it. I'm like, wait a minute. No,
Yeah,
we can
yeah,
break the cycle.
absolutely. Now, what would you say to a physician who feels isolated, targeted, or emotionally exhausted right now? What would be your response, your advice to them?
Let's go in, figure out what the initial cause was of those emotions, not of the emotional situation now, but what was, you had to have been taught what anger is.
Yeah, yeah.
You may have been 18 months old and you're having a temper tantrum and your mother says, why are you so angry? And you're like, what's anger?
Hmm.
You
Hmm.
had to have a first time you experienced fear. We start to look at when did those emotions develop? Why did they develop at that time? And then you understand more about how the emotions work. And then you can literally take away the emotional overload that that person is experiencing. And different coaches do it different ways.
Yeah,
I have a system that can get dramatic results within 2 weeks, the kind of results that you can't get with a lot of group coaching
yeah, yeah.
in 8 to 12 weeks.
Oh,
I
wow.
can do that in 2 weeks. Yeah, it's intense.
Intense. Sounds good.
There will be many Kleenex, but it's incredible the results we get when we do it that way.
Yeah. Oh,
Yeah.
wow. Awesome. Well, been such an amazing conversation with you today. And
Thank
so,
you.
one thing I mean, it sounds like just based on even through everything that you had to go through, deal with, you were still able to maintain your compassion. You
Yeah.
were still able to be true to yourself and still enjoy your job. And even after everything, I still kept that human side of you intact. What would you advise, like a younger physician who is starting training? How would you advise them to be able to navigate all the rigors of training and what their experiences are so that they can come out at the other side, still having their humanity and still having their compassion
Yeah.
intact?
The most important thing is to have relationships. Have relationships with your classmates, your work colleagues, maintain close relationships with your family, even if they aren't
Yeah,
geographically close to you during training or your first few jobs. Those relationships are going to be really powerful in
yeah,
helping you maintain your own humanity.
yeah, yeah.
And then in terms of managing the stress of it all, breath work and guided meditation.
Wow.
Meditating on your own, if you've never had anybody teach you how to do it, is a huge undertaking. But there's so much guided meditation out there right now. There are a lot of breathwork courses out there right now, and both of those things will really help you manage the anxiety, the stress, and the depression.
Oh, wow. Well, thank you so much. So if someone wanted to find you, wanted to look up you, and it's like, hey, I
Uh,
really enjoy what she said. I think this is definitely something that I would like to explore. I think I'm
mhm.
at that point in time in my life where, yes, something I need to do something different. Where can they find you?
The two best places to find me are
Yeah,
LinkedIn,
yeah.
and there is Nanette Nuessle, MD, and my website, beatdownburnout.com.
And I will definitely put those links in the show note. And yes, burnout, we probably, maybe some other from future episode, we will dig down deep into burnout because yes, that's part of your message and that's part of, what you do. Because as we know the story, we've heard it we heard so many times. Burnout with physicians is at an all-time high. But like I said, coaching, coaching is one of those areas now that we are using to combat burnout, right? And now a lot of training programs are incorporating coaching
Oh, yeah,
into their
that's exciting.
curriculum. Yeah, into their curriculum because they have seen, I mean, they've looked at the results. Like this is not, they've seen the results that people have had significant benefit. They've reduced the anxiety, the stress, the burnout rates in their trainees. And so I'm excited that that's something that's coming into our medical training because I believe that there are a lot of physicians, they want to have to go through the cycle of burnout first and then recover from it because
Yeah.
of this information. Yeah. Well,
Yeah.
Dr. Nanette, it's been a pleasure having you today. You've been an amazing physician's keeper. I'll
Thank
be sure
you.
to put all your links in the show note. At this point in time, Dr. Nanette, I don't know if this has been in the works, but I think you need a book at this time. Is that something that you've been considering doing? I think you need to, you
I'm
need,
on chapter 4 and I'm stuck. Not stuck because I don't know what to write, but stuck because I've been busy with other things.
okay, because I was like, after all, I mean, 40 years in this, like, we need a book out sometime. So we'll be looking out.
I'm working on the book, yes.
Good. We'll be looking out for when you release this and just let us know. And definitely we will shine a spotlight on that. But thank you. I'm sure, like I said, you've been an awesome help to the physicians listening. And so if you're watching this, you're listening to this, and you have a story to tell, you're a physician and something that can help aid another physician, shed light on your journey, it's what we do here. We're physicians keepers. We look out for each other through our stories, through our experiences. Send me a message, drremlo@gmail.com, and we'll be glad to hear those stories. And that way you can also be an amazing physician's keeper, just like Dr. Nanette has been. So looking forward to seeing you all at the next episode. Please don't forget to like, share, and subscribe if you did benefit something, which I know you did, from this episode. Yes, you had something to say.
And those of you who are already subscribed, if you have not rated her podcast, please do so. It is an amazing resource for physicians.
Well, thank you so much. I appreciate that shout out. Yes, absolutely. And I do this because, like I said, from my own experience, my journey, I know that there's something every physician has gone through that can help someone else. Your story is not too small. You may think it's insignificant, but that may just be that one thing that that one physician needs to hear to let them know that their lived experiences are valid, their stories they matter, right? And so your voice matters, and we want to help you. We want to help you with that. So send me a message if this resonates with you. So thank you, Dr. Nanette. I'll be looking forward to hearing from you at another time.
Thank you very much.
Thank you for listening to Physicians Keepers. I hope today's conversation gave you something useful to carry into your life or practice. If it resonated, share it with another physician who might need it. And if you have a story that could help someone else, I'd love to hear from you. Connect with me on social media or send me an email. See you in the next episode.